Hello, how are you? Welcome to a new installment of your Pharmacy Assistant. On this occasion, we would talk about what it is used for and how it is used. So let's take a look.
Hello, everyone. I'm glad you're here to learn about Lysine Clonixinate, a non-steroidal anti-inflammatory drug that can help manage pain and inflammation. First, let's discuss what Lysine Clonixinate is and why it's prescribed. This medication is commonly used for conditions like muscle pain, toothaches, and even migraine treatment. It is especially valued for its effectiveness and relatively fast action. But how does Lysine Clonixinate work? Simply put, it blocks certain substances in the body that cause inflammation and pain. This action helps reduce the discomfort associated with inflammation. Now to the important part, how to take it. The generally recommended starting dose is 125 milligrams to 250 milligrams every 6 to 8 hours. It is crucial not to exceed the maximum daily dose and to follow the specific guidelines provided by your doctor for the best results. However, like any medication, Lysine Clonixinate has potential side effects, such as an upset stomach, nausea, or dizziness. Be cautious and consult your doctor if you experience any adverse effects or have conditions like asthma or kidney problems, as these may increase the risk of side effects. In conclusion, Lysine Clonixinate can be a valuable medication when used correctly. Always make sure to follow the prescribed dosage and be mindful of its side effects. Remember that your health is paramount, and any medication should be taken with care and an understanding of its effect. Thank you for your attention, and take care of your health.
If you've made it this far, let us know in the comments why you're using this medicine.